After the shock of your breast cancer diagnosis subsides, most women want to know, what questions should I ask my doctor? I'm going to tackle this question today, but I'm going to respond to it in two parts. So today is part one. If you've just been diagnosed, you need to start by asking a little bit about the type of breast cancer you have, so you can begin to put everything that follows into a context for making your decisions. Now, when I say type, what I really mean is the kind of breast cells your cancer actually started from. And within that type, then if you want to get more detailed, you could ask things, well, is it one of the good kinds or one of the bad kinds of breast cancer? In other words, is it going to grow fast? Is it one of the faster growing forms? Or is it the kind of breast cancer that's maybe taken 8 to 10 years to get there? You see, most people don't realize that many tumors have been sitting around there growing for years. But as soon as they're diagnosed, they think, oh, it's going to go gangbusters. Yet in reality, you see, by the time you can actually feel a lump, by the time it's palpable, it's really been there a long time. So really often it's the diagnosis itself that really is traumatizing you. And hopefully knowing that, you just didn't somehow develop something overnight will help remove some of the urgency, some of the pressure that you're feeling right now, right after diagnosis, so that you can kind of step back a little bit and regain some balance and composure to think about what is the next best thing for you to do. Now, after you've reached that place, from here, what you really want to do is decide the amount of detail that you really want to know, what you're comfortable with. And depending on the extent to which you want to participate in deciding your treatment, well, then you actually ask more or less questions. So if you want more say in your treatment, then you're going to need more information. For example, you might ask such questions as, well, is this a type of breast cancer that spreads, or does it stay more localized? What stage of disease am I in? Is it early? Is it late? These are the type of questions that will help you understand how your cancer is growing in your body, how it could spread, and how long that might take, which is really critical when making your treatment choices. But if you've already had a preliminary biopsy, then what you might want to ask is, has it spread? What is then the best treatment of my disease, depending on that response? Well, is there any treatment for it besides that? Because although they're going to use whatever the best treatment currently is, you still want to find out what your options are. This is the time to find out everything that you need to know about all the possibilities that exist. Now, on the other hand, if you don't want to be as involved in the treatment decision, then I still recommend that you ask questions, because it's going to still give you that sense of involvement, which is really critical to your healing. So you might want to focus more on the effects of that treatment that your doctor is recommending. For example, is it going to affect my day-to-day life? Will I still be able to work? Well, what limitations will I really be able, to anticipate? What about my energy levels? What other adjustments am I going to have to make? Will I still be able to think clearly? Because some cancer drugs affect different functions. So if you need to be able to think clearly, you're dealing with numbers, for example, you're an accountant, you don't want a therapy that's going to affect your cognitive skills, if that is important to you, or if it's going to affect your motor skills. Say you're in a situation where you're inputting a lot of data, that will affect your skills on the keyboard. Or you could be a concert violinist, and what about my coordination? That's really important. You could be a factory worker, you could be an athlete. So those are really key things to find out about the treatment that's being recommended. And by using this line of questioning, your doctor is going to start considering the issues that you consider important and build it into your treatment plan. This way, you still set some parameters that are important to you that will result in a more personalized treatment plan for you, while participating at a level that you feel comfortable with. So, it's something you're going to be able to cope with, and it's not detrimental to that. And in fact, studies show that patients who ask questions and express their concerns obtain more information from their doctors and solicit often a different response than patients who don't. So, really try to explore the basic concepts and questions that I've, sort of outlined here so that you don't get overwhelmed by the information that might totally be irrelevant to your case. The more you know, the more you know what you need to be focused on. And lastly, should you need, you know, you actually need to know this as well. Just because a doctor is the one that diagnosed you and they're offering you a treatment plan, you do have the right to refuse that. And I don't think a lot of people know that. They think they're diagnosed and, well, this is what I have to do. That's your right as well. And really, they're trying to offer you the very best that they are capable of, but still the fact remains, unless you have a very aggressive cancer, and a solid tumor that's not been growing like mushrooms, well, really it is prudent not to let anybody push you into deciding something right away. Go home, talk about it. Discuss it with people that have a good level head and are really good at making decisions and weighing pros and cons. Talk it over with people you trust, people you love. How this is going to affect you, them. And then next week, go back to your doctor and ask more questions. That's your right. Walk into your appointments with a list to make sure that, with the limited time you do have with your oncologist, you make the best of it. Take a digital tape recorder. You have the right to record your consultations, because when you're under stress, your mind and your ears can do strange things. They can get selective, and it does alter your capacity to interpret and remember key things accurately. That way you can go home, you can listen with the people that you trust, and then you can make a much more balanced decision, because this is your life we're talking about. You're not going out, comparing models of cars or whatever. This is your life. You get, you take a lot of time when you're deciding any other decision in your life. So ask yourself, 10 years later down the road, when you're considering something, would I be happy with what I'm about to do here? Consider everything with the view to minimizing regret. That way, you won't do anything now that you're going to be sorry for later. Take the time. You have it.